Hi, my name's Gemma and I'm an assistant psychologist here at the private therapy clinic. In this video, I'll be talking about borderline personality disorder, how it affects relationships, and what you can do to help your partner if they have borderline personality disorder. Borderline personality disorder is characterised by severe mood swings, impulsive behaviour, and difficulty maintaining personal relationships. People who suffer from borderline personality disorder, or BPD, often have feelings of abandonment. This means that they are likely to mistrust their partner, which, combined with intense emotions, often makes for a rocky relationship. Finding it hard to manage emotions is one of the trickiest parts of having borderline personality disorder. People often find it hard to return to an emotional baseline. For example, someone with BPD would experience longer highs, but also this would mean they would experience longer lows. So what can you do if your partner's got BPD? Well, the most important thing to remember is that a lot of their behaviours are reactions to deep emotional pain that they experienced in childhood. This isn't always the case, but it's often most likely. One of the most valuable things that you as a partner can do is learn about BPD. The more that you understand your partner's behaviour, the more likely you are to be able to work through the reactions that they may have. It's really important to look after yourself if your partner has BPD. It can be very easy to blame yourself for their behaviours, but you must remember that they are responsible for their own actions and behaviours. We often use the 3C rule to remember this. The 3C rule goes as follows. 1, I didn't cause this. 2, I can't control this. And 3, I can't cure this. It may be helpful to remind yourself of these 3 C's when you are experiencing a strong reaction from your partner. Communication in any relationship is really important. However, communicating with someone who has BPD can be particularly challenging. Often people describe arguing with someone who has BPD as like arguing with a small child. They often act irrationally and say things that can be very cruel and not really mean them. The fear of abandonment that I mentioned earlier can often cause people with BPD to overreact in situations. This can lead to fits of rage, violence, or verbal abuse. Now I'm going to talk you through some tips which may help you communicate better with your partner. Firstly, it's really important to know when the right time to talk is. If your partner is angry or in a fit of rage or even violent, now is definitely not the right time to talk to them. Perhaps say something like, maybe we should talk later when we're both calm. Secondly, it's important to listen and be sympathetic to your partner, even if you don't agree with what they're saying. You can say things like, okay, I see, carry on. This reassures your partner that you are listening to them and that their feelings are heard. It's also really important to focus on the emotion that your partner is trying to portray, not necessarily the words they're saying. Often people find it hard to use words to communicate their emotions, so it can be really helpful if you can try and look past these words and just see the raw emotion that they're experiencing. Continuing to point out when your partner is wrong can make them feel like their feelings aren't being listened to. It's really important to try and understand from their perspective where they're coming from. When strong emotions do occur, it may be helpful to try and distract your partner. Maybe try and do things like go for a walk or do some household chores. And finally, try to talk about other things than borderline personality disorder. I'm now going to talk a bit about setting boundaries in your relationship. Now, setting boundaries with a partner who have borderline personality disorder can be a really effective way for you to have different options to react to their behaviour. Now, your partner who has borderline personality disorder might think that these boundaries are a way of you trying to separate them or abandon them. And this stems from that fear of abandonment that I mentioned earlier in the video. When you are both calm and your partner is aware that you would like to set some boundaries in your relationship, think about what behaviour you will no longer tolerate. For example, if you will no longer tolerate your partner shouting abuse at you, simply say, I will no longer tolerate you shouting abuse at me, and if you do, I will walk out of this relationship. It's then important to reassure your partner that you love them and that you want to stay with them, and that by doing this and setting these boundaries, you are offering a chance for your relationship to survive. You could say something along the lines of, your behaviour is causing me a lot of stress and I need you to make this change for me. It's really important that you understand setting boundaries takes time. It's not going to be an overnight process, but it can really help a relationship. It's really important for your partner to understand the consequences if they overstep the boundary. but it's also important that you don't make consequences which you don't feel like you can carry out. It's human nature for your partner to test these boundaries, and it's likely they will do so. So only set consequences which you feel like you can carry out. If you do not carry out the consequences, the boundaries then become meaningless, and it's likely your partner will carry on these negative behaviours. DBT, or Dialectical Behaviour Therapy, can be really helpful for people with borderline personality disorder. It can help individuals work through their trust issues and come up with coping mechanisms to manage their emotions. Individuals with BPD can be extremely caring, affectionate and compassionate. They often just want to spend lots of time with their other half and enjoy physical relationships too. Just because someone has borderline personality disorder does not mean that they are incapable of long-lasting romantic relationships. Thank you so much for watching, and if anyone has any questions, please comment them below. If you would like to get professional help, I will link below the website to the private therapy clinic, which is where I work. Thanks so much for watching. Have a good day. Bye.